how to approach a case of sleep apnea. Okay, there are three types of sleep apneas. One is obstructive sleep apnea, and number two is central sleep apnea. Number third is mixed obstructive and central sleep apnea. We will not go into the details of these, not asked in the exam. This is just for information. How much is the incidence of obstructive sleep apnea in the community? It is 3 to 7% in men and 2 to 5% in women. How to define obstructive sleep apnea? It is a medical condition in which obstruction or interruption of breathing occurs due to temporary blockage of the airways or air pipes. It occurs due to relaxation of throat muscles. So this is the simple definition. Well, how the scenarios are coming? They're coming with headache. They're coming with morning time fatigue. They're coming with weight gain and fatigue. They are also appearing in the exam as erectile dysfunction. So if it is coming with the headache, we have to apply the Socrates, and we have to first classify into one of the three groups as we discussed, whether it is acute headache, intermittent headache, or chronic headache. So most likely it will be chronic headache, morning time headache. The patient will give you history that my sleep is not refreshing me. When I'm waking up, I'm not fresh. And if you will ask the history, the patient will be giving you that whenever I got the time during the daytime, I fall asleep. While watching the TV, I'm falling asleep. Patient is a taxi driver. When he's parking, he's just waiting at the signal, he's sleeping. Okay, so this is another way now the case is coming. Why to stop the driving in such cases? They are prone to have the accidents, and they are just like sleeping when they are standing at the red signal. They are sleeping. And they got the few minutes time and they fall asleep. So as a result of this, the people who are the cars or the vehicles behind him, they are just giving him horns, and then he is waking up and he is trying to move fast. As a result of this, he can do the accident. Okay. Differential diagnosis of weight gain, we have already discussed the mnemonic champion. C for Cushing syndrome, H for hypothyroidism, A for acromegaly, M for metabolic syndrome, P for polycystic ovarian syndrome, O for obstructive sleep apnea, and O for obesity, simple obesity, and diabetes mellitus type 2. So apply this the causes of weight gain, champion, you will reach to the cause of the obesity. As a complication of obesity, we should remember what could be the complications of obesity. Patient can develop obstructive sleep apnea like this patient, carpal tunnel syndrome. They are at risk to develop high blood pressure, diabetes mellitus. At risk to develop the high cholesterol level. They are at risk to develop ischemic heart disease, cerebrovascular accident, CVA, and they are at risk to develop the malignancies. So, complications of obstructive sleep apnea, they are at risk to develop diabetes, hypertension, CVA, carpal tunnel syndrome, erectile dysfunctions, depression, mood problems, irritability, and in the lungs, because they are having the increased PCO2 levels, so they can develop type 2 respiratory failure, and they are prone to develop pulmonary hypertension. And the long standing, they can develop cor pulmonale. They are prone to have accidents. This is also the complication. Clinical features. They can present with excessive daytime sleepiness, snoring during sleeping, interrupted sleep pattern. The partner will tell, spouse will tell that the person is having the snoring, and stopped breathing for the brief period of time, apnea. If it is 30 seconds or more, it is apnea. If it is 10 seconds, up to 10 seconds or so, it is hypopnea. So whenever they got the time during the daytime, they fall asleep. While they are at work, while they are watching TV, while they are waiting at the signals, they have decreased sex drive, they have erectile dysfunction, they have nocturia, they have mood changes, irritability, anxiety, depression. They have decreased cognitive performance also because of high PCO2 level. Important question to ask to obstructive sleep apnea patients. Are you taking any medicine, sleeping pills? Very important to ask if the person is taking, we have to stop this. And any long-standing disease you are running. So these are the two important questions. One is to find out the cause, and the second one is to find out the complication associated with obstructive sleep apnea. Causes of sleep apnea, obstructive sleep apnea. Obesity is one of the causes. But remember, 20% of the cases of obstructive sleep apnea can be having the normal BMI. So it can occur with normal BMI up to 20 to 30% of the cases. It can occur in thin persons also. Okay. What are the causes other than the obesity? So increased soft tissue growth around the airways. So he's not obese, but there is soft tissue growth around the airways. Old age, they have decreased muscle tone of the throat muscles. So they can have obstructive sleep apnea despite of the normal BMI. Person is on sedative drugs, continuously taking, can have this problem, or alcohol, excessive alcohol intake. Some people, they have structural features leading to narrowing of the airways, large tongue, tonsillar enlargement, enlarged adenoids. So although he's not obese, she's not obese, but having the obstructive sleep apnea. So I think now it's very clear that BMI may be normal in such cases. How to examine the patient with obstructive sleep apnea? We have to see the build of the patient, obese or no, short neck is there or no, coarse facial features are there or no, like our patient. She's having the coarse facial features, acromegaly. Ask BMI to the patient, they will give you the BMI. If you will ask the patient, they will give you BMI. If you will ask the collar size, they will tell you about the collar size also. So if male more than 17 centimeter collar size, they are prone to develop obstructive sleep apnea. Female, if they are more than 14 centimeter collar size, they are also prone to develop obstructive sleep apnea. Mouth, we have to see the lip size, tongue size, throat opening, tonsils, adenoids. Anyone who is having a smaller jaw is prone to develop prognathism, like acromegaly patient. They also at risk to develop. Not only the mouth, but also the nose. Deformity of the nose deformity like DNS or polyps, they can also making them prone to develop this problem. Neck, we already discussed short neck and the fat around the neck. Anyone who is having thyroid gland enlarged or any other lumps, they are prone to develop also. Acanthosis nigricans, tags are there or no? They are also indicating that the person can have the risk to develop this. In examination, these are not acanthosis nigricans and tags. They are also, during the examination, we have to find it out. So they will suggest like the person either having obesity or acromegaly or the other causes of acanthosis nigricans. In the chest and CVS examination, we have to find out the features of heart failure is there or no, pulmonary hypertension features are there or no. In the hands examination, we have to see spat-like hands are there or no, thick skin is there or no. We have to rule out carpal tunnel syndrome. Skin condition, how is the skin condition? Any anemia features or polycythemia features are there or no. Check the blood pressure, pulse of the patient, random blood glucose, and features of proximal myopathy. Differential diagnosis of obstructive sleep apnea is hypoventilation syndrome, or maybe simple obesity could be included in differential diagnosis. Investigations, how to investigate a patient with suspected obstructive sleep apnea. Simple studies nowadays, they are recommending that just check the pulse oximetry while the patient is sleeping and do the video recording. This may be all needed to confirm the diagnosis. Video recording, like they are checking how many times the patient is having apnea spells or hypopnea spells in 1 hour time. So they can calculate, and the pulse oximeter is telling the saturation is going down. But the diagnostic test for obstructive sleep apnea is polysomnography, or in simple words, you can say sleep study. You can inform to the patient, we will do for you a sleep study. Okay. So on the video recording, we can see how many times hypopnea and apnea spells are occurring. The snoring is there or no. Then the other test, arterial blood gas. We can see the PO2 level and PCO2 level. PCO2 will be high. If the person is having complication of obstructive sleep apnea or associated complications like carpal tunnel syndrome, then we can do other investigation for carpal tunnel like nerve conduction study, EMG. If diabetes associated, workup for the diabetes, hypertension associated, do the workup for hypertension. Cardiomyopathy or heart failure is suspected, do the workup. How to manage such patients? We have to inform, avoid sedative agents, avoid muscle relaxants, stop driving, stop smoking, avoid alcohol, especially 4 to 6 hours before sleeping. Don't take any alcohol. Exercise plan should be given, weight reduction plan should be given, and we have to do certain things to improve the sleep pattern during the sleep, like mandibular advancement devices we can use. So if the person is mild to moderate obese, weight reduction plan, dietitian referral, active lifestyle will all be enough. But if the patient is having moderate to severe obstructive sleep apnea, then CPAP should be applied. So CPAP is continuous positive airway pressure that keeps the airway open during sleeping. Then there are surgical options for the treatment of obstructive sleep apnea to relieve the obstruction. For example, if the person is having tonsillar enlargement, so tonsillectomy can be done. Adenoidectomy can be done. If uvula is enlarged, uvuloplasty can be done, and other procedure like palatopharyngeoplasty can be done. Weight reduction surgeries are increasing nowadays. That should be also informed as an option in the treatment. And other option is sometime in very advanced cases, we can go for tracheostomy also in very minimal cases, number of cases. Other options, they are doing nowadays radiofrequency ablation to the target tissues. It will cause the coagulative necrosis of the tissue. Some other techniques they are doing, upper airway stimulation technique. So this is all about the management.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.